Hello, today I would like to comment on a recent Facebook post I came across in a group dedicated to acupuncture. This post describes a clinical case. What compelled me to make this video is the fact that in this post, a practitioner discussed all aspects of this case from the position of Western diagnosis and the use of enzymes, Western drugs, and many other things. But very little attention was directed at differentiating this case in terms of Chinese medicine pattern diagnosis. I find it very unfortunate because the power of Chinese medicine lies in its ability to break down complicated syndromes into pattern diagnosis. This is how we solve complicated cases. We solve patterns one by one or a few at a time. That's what makes Chinese medicine so unique. We can use proven methods and strategies created by generations of practitioners who lived before us, and we can do it with excellent results provided we have correct diagnosis. Any complicated disease can be broken down into pattern diagnosis, and only by treating these patterns can we hope to achieve meaningful clinical results. And so, allow me to present this case to you. I regrouped some of the facts from the original post to make it more accessible, first of all, to me and hopefully to the rest of the listeners. And so we're dealing here with a man whose chief complaint is a progressively difficult swallowing over the past 2 years. This patient has a sensation of something stuck in the throat. There is a suspicion that he has LPR, or the silent reflux, indicated by throat inflammation, coughing after eating, and swallowing difficulties. There is also shortness of breath during eating, and the patient has cold hands. The practitioner says that the patient exhibits symptoms similar to Raynaud's syndrome, so I presume he has cold hands and most probably feet as well. I need to clarify that. Anyways, he also has a small hiatal hernia and weakness of the epiglottis, as observed during barium swallow test. Swallowing becomes difficult after 3 bites, requiring water with every bite or after every swallow. The patient has a stutter and is described as socially awkward, which may suggest a neurological angle. Medically, he tried broad-spectrum enzymes and specific enzymes without any noticeable results. And he was also prescribed pantoprazole, which helps to reduce shortness of breath after eating. Doctors also prescribed Wellbutrin to test the assumption that his difficulty swallowing has a psychological component, and this treatment did not produce good results. He was also prescribed an herbal formula, Ban Xia Hou Po Tang, and he tried it for 1 month without any noticeable changes. There were also alternative therapies and relief measures that he used. Sound therapy with occasional relief. What definitely helped with was gargling with baking soda, and swallowing exercises did not produce any help. Now, let's see what his tongue would tell us. Now, I always follow the same protocol when I describe a tongue. This protocol helps me to avoid jumping to conclusions or missing any diagnostic clues. I always start with the coating of the tongue. Then I describe its moisture. Then I look at the shape of the tongue, its color. Then I look at the texture of the tongue. And finally, I look at the sublingual veins. Unfortunately, in this case, I don't have the image of the sublingual veins. But let us take a look at the close-up of this tongue. I also advise you to change the background to this gray color, because then it will help you to better understand true colors of the tongue. Because in the context of red lips and other things, you may not notice the true colors, especially when it comes to nuances. So, let's take a look at the coating. We can see that the coating is actually pale yellow. It's thick and greasy. We can already tell there is phlegm, dampness, accumulation. But there is also an element of heat, because the color of the tongue is not white, it's yellowish. In terms of moisture of the tongue, we can see that the body of the tongue is moist, especially closer to the tip. And it tells us that this person has difficulty transforming fluids. When it comes to the shape of the tongue, there are 4 features we need to be aware of. Number 1, this is a long tongue. And so we can say that excess of yang qi is thrusting up and out. So from the root of the tongue, which represents the bottom of the body, it goes all the way up. But at the same time, we don't see much of the narrowing of the sides of the tongue. So yang qi does not burn up the fluids, meaning there is no yin deficiency. However, the tip of the tongue is red, and therefore we are definitely dealing with heat in the heart as part of this presentation. Next, I would like you to take a look at the elevated edges of the tongue, and they come with teeth marks. Now, this is a tough call, but I tend to think of this tongue as of this sign as liver qi stagnation. However, it's not very pronounced according to this tongue image. I mean, the image of the tongue is not screaming at us liver qi stagnation. And especially if you look at the third feature, which is teeth marks on the sides of the tongue, there is a clear indication of spleen qi deficiency with dampness accumulation. We can also see the fourth feature, which is a depression in the anterior third of the tongue, a sign of lang qi or zong qi deficiency, the gathering qi. Next, we can look at the color of the tongue. Overall, this is a pink tongue, pink color. However, we have a red tip, already mentioned that, and also there are red edges of the tongue. So there is heart fire, but there is also heat in the liver. That would explain the neurological component a little bit better. The texture of the tongue, we can see irregular creases in the middle third of the tongue. And so we have underlying stomach yin deficiency. These creases are sent to the proximal third of the tongue, meaning stomach yin deficiency is drawing from the kidney resources. Now, let's put it all together. The sensation of something stuck in the throat, the inability to swallow, is called plum pit qi, mei he qi. This term describes a condition where a person feels a sensation of something stuck in the throat, but without an actual physical obstruction. The feeling can come and go, and it is often associated with an emotional stress or psychological tension. In Chinese medicine, plum pit qi is generally considered a manifestation of liver qi stagnation. Hence, we often observe emotional components as part of this clinical case. The tongue indicates, and if you look at the tongue, it indicates the presence of liver qi stagnation. However, in this case, liver qi stagnation progresses into liver heat as the sides of the tongue are red. Liver qi stagnation can also affect the spleen and create phlegm, which compounds the sensation in the throat. Again, we have evidence of spleen qi deficiency and dampness accumulation as evidenced by teeth marks on the sides of the tongue. We can also observe the evidence of phlegm, a thick, slippery, greasy coating. However, its color is slightly yellow, a sign that phlegm is turning into heat. Hence, ban xia hou po tang that was prescribed to this patient does not work, although this is the main formula to treat plum pet qi. And it does not work because it's a warming formula. And in a situation where heat already is building up, this formula would only make things worse. Therefore, the first step, if I were to treat this patient, I would consider releasing liver qi stagnation that turns into heat. And I would start with the formula. If we are to treat this person with standard pre-made formulas, I would start with Jia Wei, Xiao Yao San. Jia Wei means with flavors, 2 flavors, Xiao Yao San plus 2 extra herbs. This is a formula prescribed in cases of constrained liver qi with spleen qi deficiency that transforms into heat. This formula should have a positive effect on the heart heat as well, as the heat in the heart is most likely transferred from the liver. And the herb zhizi treats liver heat, but it also would treat heart heat as well. Now, for the phlegm accumulation, I would actually prescribe Wen Dan Tang. That would be the formula that deals with phlegm heat and is specifically it specifically treats stomach phlegm heat. It would be very beneficial to treat acid reflux. Next, I would consider addressing lung qi deficiency with Wuzhong Yi Qi Tang. In the initial phases of the treatment, I would focus primarily on regulating qi and transforming phlegm, adding only modest amounts of qi tonics, because qi tonics generally produce heat. In the later stages, once phlegm is transformed and heat is cleared, I would focus my attention on building qi and also building back stomach and kidney yin. And so this concludes my presentation for this case. And traditionally, I always say if you have a health issue and would like to send me a picture of your tongue to know what your tongue tells on you, don't hesitate to contact me. I'll be very happy to speak about your tongue next. Thank you, and I will see you next time.